everyone. Let's talk about how the Unified Protocol was developed and why it is such an exciting treatment. The Unified Protocol, or UP, is a transdiagnostic treatment. And what this fancy term means is that it's meant to be applicable across a range of diagnoses and presenting problems. Why is a transdiagnostic treatment a good idea? It's a great question. In psychology, we used to have a different treatment for every disorder. So if someone had depression, we would give them the depression treatment. And if they had OCD, we would use the OCD treatment, etc. However, there were a couple of problems with this approach. First, there is a substantial co-occurrence of psychological diagnoses. Research suggests that about 75% of patients meet criteria for more than one disorder when they attend an intake. Further, patients often notice that their concerns interact. For example, they might be quicker to anger if they're feeling more depressed, or their OCD symptoms might be more prominent when they're already anxious about other things. So asking a patient to artificially separate their presenting problems doesn't match their lived experience and can be very frustrating. Second, there is notable symptom overlap across disorders. My favorite example of this is worry. Worry is a feature of generalized anxiety disorder, where folks might worry about a wide range of topics. It's present in social anxiety disorder, when patients worry about social evaluation. It's present in panic disorder, when patients worry about having panic attacks. It shows up in somatic symptom disorder, when patients worry about specific physical symptoms, or in illness anxiety disorder, where patients are worried about contracting a specific illness. These are all different diagnoses, but they involve the same process, which is worry. The content of the worry is different, but the process of worrying is there. Finally, there are other specified and subthreshold presentations. Sometimes patients don't meet full criteria for a disorder, but they're still experiencing distress and impairment and would benefit from treatment. So these three things, comorbidity, symptom overlap, and other specified or subthreshold presentations, along with some research from affective neuroscience that suggests there are similarities in brain structure and function among patients with emotional disorders, really raise the question, these disorders don't seem that different, and can't we do a better job reflecting that in our treatments? And from these questions, the UP was born. The UP is meant to be applicable to patients who are struggling to manage their emotions, no matter what diagnoses they do or do not have. And in this way, the UP is meant to be a more holistic and a more realistic way for patients to improve their emotional functioning.